Importance of temporal. The first we have 5 parts. Temporal. This is mastoid part. This is squamous part. This is tympanic part. This is styloid part. Then this is petrous part. Okay, this is 5 part. Now each one I will tell separately. This is the squamous part of the temporal bone. We have 2 surfaces, external surface, internal surface, superior border and anterior inferior border. So 2 surface, 2 border. This is mastoid bone. We have superior border and posterior border and one process that is called mastoid process. The tympanic bone. This is the tympanic bone. We have 2 surfaces, anterior surface and posterior surface. We have 3 border, lateral border, upper border, this is lower borders. So lower border with the attached to the styloid process, that is called sheath of styloid process, this part. Then petrous temporal bone, we have anterior border, superior border and inferior border. So 3 border and 2 surface, 3 surface, sorry, anterior surface, posterior surface, this is inferior surface. Then petrous process has apex and base. Okay, so the base is attached to the squamous part of the temporal bone. We have anterior border, it is attached to the crater wing of the sphenoid. You can see the foramen of rotundum, foramen of ovate, foramen of spinosum. So the anterior border is attached to the crater wing of the sphenoid. Superior border, you can see the impression like this. This is called superficial petrosal sinus impression. Then same thing in anterior surface, you can see 3 hollow surface. First hollow surface, second hollow surface and third hollow surface. So the first hollow surface is called for Meckel's cave, that is trigeminal ganglia. Then maxillary nerve and mandibular nerve. Okay. Then second hollow structure which form the roof of the cochlea. The third hollow is called tegmen tympani. Tegmen tympani form the roof of the mastoid. Then 2 ridges are there, 1 and 2. This is the irregular ridges which adherent the dura mater here. This between the second and third hollow structure you have some eminence, that is called arcuate eminence, that is produced by the superior semicircular canal. So first hollow for Meckel's have, second hollow for cochlea and third hollow for tegmen tympani. This is called arcuate eminence. This is all in the anterior surface of the petrous bones. Then you have another 2 opening. This is called greater petrosal nerve opening. This is lesser petrosal nerve opening. 2 nerves is branch from the facial nerve. This is 2 side and anterior border. Then superior border, I told superior petrosal sinus. Then posterior surface. So posterior surface we have 3 opening. Number 1, number 2, number 3. Number 1 is internal auditory meatus. All you know, facial nerve is there, labyrinthian artery is there, cochlear nerve is there, and superior and inferior vestibular nerve. This is the internal acoustic meatus. The second is vestibular aqueduct. That is opening of the vestibular aqueduct. Then third is subarachnoid fossa. That is for endolymphatic sac. Only 3 structure. So remember IVF. I stands for internal acoustic meatus, V stands for vestibular aqueduct, and F for fossa, that is subarachnoid fossa. This is called subarachnoid fossa. So this is inferior surface and inferior border. So inferior border, you can see the impression. This is called inferior petrosal sinus. In superior border, we saw that is superior petrosal sinus. So 3 surface, 3 border of the petrous bone. Okay. Then inferior surface, you can see that is jugular fossa, carotid canal. Then this part is carotid canal. That is apex of the petrous of the bone. Between the carotid canal and jugular foramen, you have the foramen for Jacobson's nerve, where the sensory branch of the jugular foramen. Then between the mastoid part and the Jacobs nerve, you have the another foramen is called Arnold nerve. That is from the vagus nerves. These 2 parts are there. Then between the carotid and jugular fossa, we have the triangular fossa above. This is called cochlear canaliculi. This is called cochlear canaliculi. But posterior surface we saw vestibular canaliculi. This is for cochlear canaliculi. These are the important structure in the inferior surface of the petrous. Now in mastoid bone, you can see the mastoid emissary vein. You have the 5 muscle attachments. Start from posterior auricular muscles, occipitofrontalis muscle, sternocleidomastoid muscle, mastoid muscle, and you can see the supraspinatus capitis and longissimus capitis. These muscles will be there. In the posterior border, you can see the occipital groove, where the occipital arteries go. Then the mastoid bone has the external surface and internal surface. Internal surface, you can see the sigmoid sinus. It's called sigmoid sinus. These 2 things will be there. In squamous part, we can see the middle temporal vessels. Then you can see the supramastoid crust, that is a Henle spine. Then you can see the supramastoid line or superior temporal line. This triangle is called McEwan's triangle. That is, everybody knows that boundary, and there will be the posterior canal wall and superior temporal line. The both line you have to detect the imaginary tangential line. From here to 1.25 centimeter medial to the mastoid air cell system are there. Then in that this is the zygomatic process. Now you can see the lateral border of the tympanic bone, that is attached to the cartilage part of the external arterial canal. This is upper border, which is have the petrotympanic fissure. That is the petrous bone inside. This is petrotympanic fissure, where the anterior ligamenta malleus and cauda tympani nerve and anterior tympanic artery, all 3 structures are going for the petrotympanic fissures. The lower board will give the attachment to the cervical fascia, where with the stylar process. Stylar process, you can see the stylomastoid foramen. You can see the stylomastoid foramen where the facial nerve comes out. In styloid process, you can see anteriorly styloclassus and posteriorly stylohyoid muscles and medially stylopharyngeus muscles. Mastoid tip, you have the relation to the external carotid artery, and base of the styloid you will have the relations of facial nerve. These are the 3 important sections. The 2 ligaments also attached: the stylohyoid ligament, stylomandibular ligaments. This is about the styloid. Then last you have the external auditory meatus. We have superior, anterior, inferior and posterior. You can see that anterior part of the external auditory canal and posterior, that is lower half of the posterior half of the external auditory canal. These are all formed from the tympanic part of the temporal bone. The remaining is superior part of the external auditory canal and upper half of the posterior canal wall, which is formed by the squamous part of the temporal bone. So this is about the external auditory canal. These are the surgical important and relation of the temporal bone.